Bismillahirrahmanirrahim. My name is mashaal Zahid, and the topic of my case study was male pseudohermaphrodite in the Shetland cross sheep. Moving on towards the case. The case was 1.5-year-old Shetland cross sheep was presented at the University of the California. On the history, the owner stated that initially from the birth, the sheep was thought to be female on the basis of appearance of external female organs. But as the animal aged, the male-like characters appeared. The history, it was stated that the sheep was born as a triplet. Moving to next words, the physical exam was conducted in which on the right lateral recumbency there were female reproductive genital organs seen, but on the dorsal recumbency when the inguinal region was palpated, there were structures which were suspected to be gonads, but there was no prepuce and no penis. Moving forward, further testing was done in abdominal ultrasonography. There were no gonads present, and by using vaginal speculum, vaginal length was less than 5 cm. Further genetic analysis was done, and there was blood chimerism seen. In the blood chimerism, there is both XX and XY present, and also in this case there was SRY gene also present. And further there was comparison done of the steroid hormones between this case and other 3 normal breeding rams, in which their steroid hormones were compared, and as a result the level of 17 hydroxyprogesterone and 20 hydroxyprogesterone were raised of this patient as compared to other 3 breeding rams. So in the treatment, the surgery was performed, general anesthesia was given, and laparoscopy was conducted. On exploring the abdomen, there were no female genital organs present, and furthermore in the bilateral parainguinal orchiectomy, the spermatic cord was clearly seen, and also there were 2 masses seen which were suspected to be testes, but they were in inguinal region, but they were given to the histopathological examination to further confirm what are these. So in the histopathology of these inguinal masses, the seminiferous tubules were typically seen, which indicated that those masses were testes. But moreover, we saw that there was atrophy of seminiferous tubules, and the germ cells were decreased, and also the Leydig cells were immature. Normally, we know that Leydig cell need low temperature for spermatogenesis, but in this case, as the testes were not descended, they were retained in the body, and as we know, the temperature of the body is higher, which is detrimental for spermatogenesis. There are 3 known pathogenesis of male pseudohermaphrodite. So the first point in this pathogenesis is persistent Mullerian duct syndrome. We know that Mullerian duct is responsible for the production of the female reproductive system, but in this case, in persistent Mullerian duct syndrome, there is mutation of anti-Mullerian receptors, so that as a consequence, as a result, the external genitalia is male-like and the internal genitalia is male plus female. It means that there is female reproductive organs also present, such as uterus, and the male reproductive organs is at the end of these, such as testes. Secondly, the point is androgen insensitivity. We know that normally what is androgen? The testes produces androgen, which are testosterone. What is androgen insensitivity? Androgen insensitivity means the testosterone, there is a deficiency of intracellular androgen receptors. So what will happen? So there will be lack of internal and external male organs. The external genitalia will be female-like and external genitalia is rudimentary. But thirdly, there is the deficiency of 5-alpha reductase. Normally in the body, the 17-hydroxyprogesterone, which we discussed earlier in the slides, is the precursor of the cholesterol, which is further converted into the testosterone, and the testosterone is further converted into dihydrotestosterone in the presence of 5-alpha reductase. But when alpha reductase is not present, it is deficient, and testosterone will start accumulating in the cells. Furthermore, there will be no conversion of 17-hydroxyprogesterone into the testosterone, and that will result also into the accumulation of 17-hydroxyprogesterone in the blood. That is the reason when we compared those 3 normal breeding rams with this case, then 17-hydroxyprogesterone and 20-hydroxyprogesterone levels were increased in our case. This is the reason of pathogenesis of this case. Lastly, we will see that the learning points. Blood chimerism जो है, it is an incidental finding, not necessarily the cause of the sexual ambiguity. Secondly, the elevated serum 17-hydroxyprogesterone could be a supportive evidence for the 5-reductase insufficiency. And lastly, the transabdominal laparoscopy can be utilized for the exploration of the caudal abdomen in cases of the sexual ambiguity with the potential advantage of using light sedation and low post-operative morbidity. Thank you.